Ever open a med search chapter, see all the bolded terms, and feel lost before reading the first line? I've been there. Hi friends, I'm Nurse Mia, and welcome back to the GetZen RN study group. This part 1 of the chapter, Key Terms Made Simple. It's exactly why we start here, because those terms make the rest of the chapter finally make sense. Key terms are just a small part of the work, but they unlock the rest. If you learn term first, the rest becomes easier to absorb. Those words are the foundation. Without them, you'll read the whole chapter as a guesswork. Most chapters start with 10, 40 terms, and each one connects at least one clinical pathway: lab, symptoms, nursing intervention, diagnostics. These are just test words. They show up in NCLEX terms, in nursing reports, and real patient conversation. Imagine your patient says, "Nurse, the doctor said my atrial fibrillation is causing hypertension and it might be from polypharmacy. What does that mean?" You will need a language not just to understand it, but to explain it with confidence. Let's break it down term by term, cue by cue, calm and clear. Let's get started.
Hi, welcome back to new chapter of terminology. We have chapter 19, coordinating care for patients with immune. So this chapter is also very long in key terms. There are 28. So let's start with number 1. So it's an adaptive response, a specific immune response to a foreign antigen that develops over time. So think of it like a memory game. Your body adapts and remembers how to fight off, knowing the invaders. So then the next one, it's allergen. No, allergen. It's a substance that triggers an allergic response. So allergen, it's equal like allergy trigger, like pollen, peanuts. Then we have a word very challenge for me to say it, anaphylaxis. So it's a severe life-threatening allergic reaction that occurs like rapidly. So think like Anna, it's an emergency, immediate action needed, epinephrine. Then we have the next one, it's angioedema. So it's a swallowing breath, swallowing beneath the skin, often around the eyes and lips due to an allergic reaction. So angio is vessel and swallowing is due to vessel leakage. So edema is that swallowing. Then the antibody, it's a protein made by B cells that recognizes and binds to antigens. So think of it as like lock and key. So antibody finds and locks into the antigen. So now we have antigen, a substance that occurs the immune system to produce antibodies. So antigen, it's generate a immune response. It's something against anti. Atopic, so it's a genetic tendency to develop allergic diseases. So atopic, it's allergy prone, like eczema, asthma, hay fever. Then we have autoimmunity when the body attacks its own tissue, thinking they are foreign. So auto itself, so the immune system mistakenly attack self. So that is autoimmunity. And there are some diseases that attacks its own tissue. Autosomal dominant, so it's a genetic pattern where only one copy of the gene is needed to um, to it's needed to express a trait. So dominant, it's only one key needed. It's like a strong personality. Then we have the B cell deficiencies, a disorder where B cells don't produce antibodies properly. So the B cell is antibody builders. Deficiency means a weak defense. B lymphocytes is the white cells are responsible for producing the antibodies. So B is from the bone marrow origin. Markers makes the antibody. Then we have complement, a group of proteins that helps antibodies clear pathogens. Think of as helper squad for antibodies. So the next we have the cytotoxic. Toxic to cells refers to immune cells that kill infected or cancerous cells. So cyto means is a cell, toxic is to destroy. So yeah, so cytotoxic, it's toxic to cells, refers to immune cells that kill infected or cancerous cells. So we scroll down the page and we have histamine. So it's a chemicals released during allergic reactions cause inflammation. So that's the histamine. So histamine, it's like a itchy hives swallowing. And hypersensitivity reaction is exaggerated or inappropriate immune response to an antigen. So the hyper, we know it's up or too much, too strong, response to something small. Next, we have immunoglobulin A, the IgA. I think I talked on the previous one when we talk about the cells and A as an apples, and you think like about the breast milk. So antibodies are found in mucous membranes, saliva, tears. So IgA, it's areas with secretion like the airway, saliva. Then the immunoglobulin E, IgE, as an elephant, antibodies are involved in allergic response, and think about emergency allergies. So E, it's an for emergency. Immunoglobulin G is the next one. IgG as a giraffe. The most abundant antibody provides long-term immunity. So IgG as a general protection, like G is a general, a long-term memory. Immunoglobulin M, the first antibody produced during an immune response. IgM, M, think as first responder, main starter. Suppression, reaction in immune system activity. Suppression is like holding back immunity. Think about the transplant patient. And innate immunity, non-specific defense in present from birth. So innate, it's like inborn, immediate response. IV immunoglobulin, IVIG, it's pooled antibodies are given intravenously for immune support. So IV plus IG is like ready-made antibodies for weak immune system, that kind of thing. And a few more keywords. Primary immune dysfunction. It's an immune disorder present from birth due to genetic causes. And since it's primary, it's like first. So present at birth, inherit. And we scroll down, as you see. So the secondary immune dysfunction, it's immune problem caused by external factors. Here we have an example, chemo, HIV. So secondary caused by something else, not born with it. T cell deficiencies. So the impaired in T lymphocytes affect cell-mediated immunity. So T cells is that tactical fighters of immunity. Deficiency is like a weak cellular defense. Thymus gland is the organ where the T cell mature. So thymus, you think thymus T. They're both T. Starts with a T. So it's the T cell training. So then the T lymphocytes. It's the white blood cells are involved in cell-mediated immunity. T, think about the train in thymus and triggered infected cells. So the last one, it's the X-linked recessive. It's a genetic condition in more common in males due to a mutation on X chromosomes. X-linked equal X chromosome. So it's like receive needs 2 copies in females and 1 in males. So now is my time to tell you thanks and my goodbyes, and I hope you enjoy this terminology chapter words.
Thank you so much for being here with me today. I hope this video helped make things feel a little clearer and less overwhelming. If this supported your learning, please give it a like or share it with your fellow nursing students who might need this too. Everything we cover connects back to the real nursing, whether it's recognizing a lab, planning safe care, or knowing what to teach a patient. Let me know in the comments below, what was the most helpful thing you learned today? What still feels unclear or confusing? If this was what you hoped, and make it easy for you. If you can also let me know if you like the notes for this chapter. Check the description. I usually add some free resources there just for you. Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours, until next time, stay zen, stay grounded. Namaste. Bye for now.